Thank you for having me. My name is Thurston. I'm the CEO at Helix, and I'm here with Dr. Anthony Slonim. Thank you so much for joining us.
Great to be here, Robin.
So first, Helix's mission is to empower every individual to improve their life through DNA. And today I'm here with Tony to talk to you about what I believe is the future of consumer-initiated population sequencing. Tony?
You know, this map represents the greater Nevada community. As a health system CEO, I know that the care that my team delivers every day, every bedside, one patient, one family at a time, is only one small segment of what determines someone's overall health status. What we need to be aware of is that the environment in which they live, their genetic code, and the social determinants of health actually have much more of an impact than the clinical care that we deliver. So in Nevada, we started a population-based program where we integrated those 4 domains of data into one large data warehouse, applied some predictive analytics, and are better understanding the health and the well-being of our community. The idea was that if we could get those data in one place, strategically, we could plan for 5 to 10 years down the road where the health care needs of the community were changing. In addition, we could move from the macro of the community to the individual of the patient or the person and have them engage with their health in a very different way by providing feedback and data that allowed them to change their behavior and live healthier. The Northern Nevada community is geographically disparate and integrated in a way that makes this program unique.
And what are some of the things that we're doing, Tony, Helix and the Healthy Nevada Project together to erasing these silos and barriers?
Well, you know, Robin, the traditional approach to research is it's slow, methodical enrollment. And the Healthy Nevada Project has been very fast, and we'll share with you some of our initial data. In addition, you know, traditional research is a large effort, and it was important for us, and we're so glad to have you as partners, that we had a scalable opportunity to make this thing not only quick, but scalable at the level of the community and the state. Participant experience, we all know if you've ever participated in clinical research, it's slow, it's a little bit clunky. You know, in our project, we've got people who are motivated. We engage with participants in a way that we never have before. And they're active participants, learning how to change their behavior on the fly, and with your platform, getting apps that they can use to improve their health right on the fly.
Right when they get started in the program, which is one of the big differences, right? So this unprecedented choice and optimized participation experience is really what is driving the program. We want to improve the customer experience. We want to help them learn in the process as they get started in their DNA journey for the first time. And we want those insights not only to be actionable, but to help from a personalized perspective them begin to take the first steps as they learn more and more. Unlike microarrays that have historically been used, Exome Plus and next generation sequencing really allows for future insights. So when new research is learned or insights that we learn from directly from this project can be used instantaneously to return to the consumer, giving them a very different experience in a project like this. There's a breadth of health applications on the Helix platform. We've recently announced an ACMG 59 product and a risk score product for prostate cancer, and we are just getting started. Personal genomics is here to stay. With more than 10 million people who have already self-initiated getting testing, but it's really an individual experience. People are learning for the first time. It's not as easy as simply returning the results and having them understand that immediately. We really believe that part of it is that it has failed to bridge the gap for the consumer in terms of what information they might go back to their physician with, and we believe a project and a partnership like this fundamentally can change that. Tony?
You know, Robin, the biggest dilemma that we've had as it relates to clinical research is that it takes so darn long for it to get to the bedside and make improvements in care where people could actually benefit. And so we're very excited that the limitations of community health research are actually being overcome by this kind of a study, because we're putting that information right back in the physician's hands so that it becomes actionable, right? The usual way the medical model works is we wait till people are sick, they show up, we treat them, versus a much more public health or community-oriented model where we're looking and prioritizing prevention as an important piece of the work. And so we're excited that we'll be able to coordinate these efforts, scale them across the greater Reno community of about 1 million people, and really help us to learn how we might do this in other locations more broadly.
And Tony, maybe talk about that integration with how to help the physician after the consumer has initiated their test, got some external information, might be something like genealogy that is returned with National Geographic, but talk about that process after they get that back and then they're coming back to get information.
So at the moment what we're doing is we're looking specifically at certain cohorts of people, and our population has been very engaged in the work. They've said to us, if there is an opportunity for me to improve my health, by all means contact us on the back end. Let us know if there's particular genetic risks that we are susceptible to. Let us know if we live in a zip code where there's a potential problem that we need to be aware of. And then they're going armed with that information to their clinical team, their primary care provider and others, to help them make appropriate health and healthcare decisions.
Much more quickly is hopefully the goal. So we are definitely an inflection point. The state of genetic sequencing, if you think back to 2001 and how much it cost to sequence the first human genome, the amount and rise of scientific data availability. For the first time in human history, we will have the largest phenotype databases merged with genetic data sets that will create new insights at a pace unparalleled to many other projects in history. And if you think about it today, there's been 10 million consumers already that have initiated some sort of testing. And later, Francis D'Souza, right after us, is going to talk about how quickly the price of sequencing is coming down and how Helix plays a part in that. There are several big projects that have manifested themselves with large government initiatives. Genomics England with the 100,000 Genomes Project, the All of Us Project, which officially kicked off today for recruitment here in the US, and crowdsourced efforts to categorize more than 330,000 clinical variants in ClinVar. All of these initiatives helping us push forward really at the beginning of this massive catalyst that we believe is coming.
And Nevada is a great place to start. I believe it's a great place for us to have kicked off the inaugural health conference, because we are struggling in Nevada. If you take a closer look at the cardiac, cancer, and respiratory illness causes of death, you will see on this table that not only does Nevada exceed the national norms, but in our county in northern Nevada, where heart disease, cancer, and chronic lung disease is a real big problem, we've got work to do to make sure that we're making changes so people can live healthier lives. And it's an uphill battle a little bit, because here in Nevada, we're known for gaming and tourism and smoking and alcohol and behavioral insults to your health. So that's a lot to overcome, but nonetheless, we're on a journey to make sure we do it by giving people the data and the information so they can change their own personal behavior.
So there's a big focus, obviously, on these three causes of death. How do you think having an exome available and on a large population will help you think about not only these diseases but others?
Yeah, the best part about the approach is that it's scalable and it's actionable by doctors. We're giving information back to people so they can be smarter about their health and their healthcare risks. And importantly, the Exome Plus approach allows us to do polygenic risk scorings outside of the gene, put it together, and be able to provide people some more specific information that they might not otherwise have obtained.
And then hopefully put them on an action plan for improvement.
Absolutely. When we started the Healthy Nevada Project, we never would have realized, as we kicked off phase 2 on March 16th of this year, how impactful it might be. The launch media results were incredible. 16 million total reaches, $200,000 in value ads, more than 200,000 stories were achieved, but the personal opportunities was certainly much more than the media. We, again, in phase 1 of the project, we enrolled about 10,000 people in 48 hours and tested them all with their genomic sequences in about 96 days. We thought we'd have a hard time beating that. And in fact, when we launched phase 2, we enrolled 10,000 more people in 5 days and tested all 10,000 of them in 49 days. It's absolutely incredible. We have a wait list that continues to grow. People want to live healthier. And so we're reaching out, we're making sure that the data set actually represents our community in a very purposeful sampling methodology. And we're getting, people, 1,000 to 2,000 people a week are joining us as we're reaching out to the rural environment, we're reaching out to other members of our community who are usually underrepresented in these kinds of research.
And how important is that to create that diversity, especially from a research perspective?
Huge. We believe that if we're going to be successful and actually go about improving the population's health, that the data set that we're doing this artificial intelligence work on needs to be representative of the community that we're serving. And so that provides a really unique opportunity to make sure the science and the practical aspects of the healthcare are actually matching up.
It's amazing. On the lab side, importantly, we're extremely pleased with our ability to support this effort. We received the first samples from Reno within a week of the start of the program, and as of Friday last week, we'd already received more than 8,400 samples back from individuals, and in just 6 weeks, we processed more than 4,500 exomes in our lab in San Diego, our CLIA and CAP lab in San Diego. And the average turnaround time has been under 26 days. All of these things at leading industry standards, both in terms of performance and quality. So we're all aware of the number of projects, the big, ambitious projects that are out there right now. There are several large projects around the world that want to sequence as many as 1 million people and have budgets of $1 billion. On the scale of these projects, ours is not the largest, at least not yet. But we believe that the work we're doing through the partnership with Tony and his team will essentially allow us to move more quickly and change the model a bit, to be able to scale so quickly, create actionable results at an individual level that integrate it into the clinical care at an unprecedented speed from a turnaround time and support perspective. And we believe that programs like Healthy Nevada have the potential to quickly meet or exceed the size of the other programs because of the speed at which they're moving at. So let's put this into perspective. Let's compare the progress of Healthy Nevada to other large population sequencing efforts. The University of Alabama recently launched and announced a state-level initiative to help address challenges of chronic disease and rising costs. They have begun enrollment and plan to offer this to 10,000 people over a 5-year period. Genomics England is offering whole genomic sequencing to individuals affected by cancer and rare diseases. Their initiative launched in 2014 and recently passed 60,000 sequences just in the last few days. Geisinger and Regeneron project announced in January 2014 reported that they had completed 20,000 in the first year exomes, 30,000 exomes in 2015, and have been adding 4,000 a month since that project. They are all important in making a big contribution to what's happening from a research perspective and moving precision health forward. But the traditional barriers in setting these up continue, that you really have to increase the speed for the outcomes to improve. So you can see these projects move forward. Tony?
We couldn't do this without all of the great Healthy Nevada project partners. And certainly as we move forward beyond 50,000 in our community to 100,000 and then ultimately go to statewide sampling to reach 500,000 people, this is not just about driving enrollment or getting the next number of participants to sequence. This is about how do we actually work together to change health in a state that's not been known for being so healthy. And if we could learn things here incrementally, we may be able to apply them around the nation in other communities that are struggling just as much.
What type of partnerships do you think will be important, Tony?
You know, everything from the analytics piece to focusing on the specific diseases of cancer and lung disease, but it's even broader than that. We don't even know the untapped potential about managing a large population across a broad geographic landscape like we have here in Nevada. And I think there's things we could learn about how to use remote telephonics and monitoring and interventions that are separated from distance, quite extensively, and that might be helpful as well.
Well, I can tell you that we are very excited about the partnership and what we believe will be the impact to health. And so with that, I want to thank you for being here with me. And we're going to show a little video on what's happening with Healthy Nevada. So thank you, Tony.
Thank you, Robin. Great to be here.
This is one of those days where we'll look back and say, that was it. This was a day that we changed this community, we changed this state, we changed this nation, we changed the world.
September 15th, 2016, Renown Health and the Desert Research Institute launched the Healthy Nevada Project, a first-of-its-kind community-based population health study combining clinical, genetic, and environmental data. The goal of this visionary project? To unlock a new model of groundbreaking personalized medicine in Nevada.
I actually got data that just started this whole chain reaction into good health. Imagine this, I'm losing weight, I'm dropping my cholesterol, I'm getting healthier, and it's all specific to my DNA.
What really stood out to me was macular degeneration. I want to be able to bike as long as I can. And when I saw that eye health was a potential risk for me long term, it really felt like it put that at jeopardy. There's different food that you can take for eye health. I mean, there's different foods that you can take for different parts of health, depending on what you're working on or maybe what you have a predisposition for.
The pulmonologist that diagnosed me told me I was the first ZZ alpha he had seen in over 20 years. Do it. You never know what you're gonna find. You never know what you're gonna find. My life changed. My life was saved.
We are excited to invite 40,000 more Nevadans to join us again as we move into the next generation of this landmark study. Working with personal genomics company Helix, we'll provide our research teams from the Renown Institute for Health Innovation greater insights to take more steps toward improving overall health and tremendous long-term benefits for health outcomes, wellness, education, and research for the entire Silver State.
Thank you, Robin and Anthony.